A new report finds the price of the same prescription drug can vary by hundreds or even thousands of dollars depending on where you buy it. So far this year, the prices of more than 250 prescription drugs have jumped an average of 6%. Anna Werner reports.
Anytime I eat anything, even with a small amount of sugar in it, I have to take insulin. Where my blood sugar goes really high, I could end up in a coma and I could be dead.
Like 30 million other Americans with diabetes, Brianna Hamilton needs insulin to survive. Last year, she says she paid $60 for a 90-day supply of Novolog pens, the brand of insulin she uses. But when her insurance coverage changed this year,
I showed up at the pharmacy to pay for my 90-day supply, and it was $1,400.
Hamilton says the two types of insulin she uses, plus supplies like needles and testing strips, will now cost her $1,000 a month, even with a coupon from the manufacturer, until she hits her new insurance plan's $3,000 deductible.
It's one of those things where I tried to do everything right financially, get my degree, get a good job. And I still, if I don't cut back on a lot of stuff, I could be homeless or dead without my insulin, and that's not fair.
These real price variations we're seeing have huge health consequences for Americans.
Adam Garber is the consumer watchdog for the U.S. Public Interest Research Group. The group surveyed more than 250 pharmacies across the country for the cash prices of common medications. That's the price someone pays if they don't have insurance or are underinsured and do not qualify for coupons or savings programs sometimes offered by drug manufacturers.
These prices are often how they determine how much insurers are going to pay for the drugs. It sort of sets the whole pricing scheme up.
The study found consumers could save anywhere from $100 to $5,400 a year just by price shopping. In Ohio, they found the same inhaler being sold for $11.99 at one pharmacy and $1,136 at a different pharmacy. In North Carolina, a generic medicine to lower cholesterol could cost $7 or $393, depending on where it was purchased.
In your study, was there any clear trend between bigger versus smaller pharmacies?
You expect, when you go to the bigger pharmacy, you'll get a better deal. But our research found actually the smaller and independent pharmacies really consistently offered cheaper options for the same medications.
Stephen Schondelmeyer is a professor of pharmaceutical economics at the University of Minnesota.
At all levels of the marketplace, from the manufacturer to the wholesaler to the retailer and then the insurer and the pharmacy benefit manager, they all kind of hide the prices, don't like to make their prices transparent or known to anyone.
The National Association of Chain Drugstores told us in a statement that cash transactions only account for 8% of prescriptions written. And these prices vary according to many factors, including the exact time when the drugs were purchased from the supplier, fluctuations in product supply and thus pharmacies' costs, and other factors throughout the entire supply chain. It also says surveys like this one don't take into account widely prevalent savings programs made available to patients who pay cash. But Schondelmeyer says when it comes to the larger drugstore chains,
the big chains know that they have good name recognition, and they take advantage of that and do charge higher prices typically than your medications would cost at the local independent pharmacy.
Brianna Hamilton says her family will be cutting back more and possibly have to move until her deductible kicks in. In response to growing concerns, Eli Lilly announced yesterday it will start selling a cheaper generic insulin. Now, Novo Nordisk, the company that makes the brand of insulin that Hamilton uses, told us they want to find additional solutions that address access and affordability of their medications. Anna Werner, CBS News, New York.